What range of motion a patient should expect 6 weeks after knee replacement surgery? The answer is at 6 weeks, if we are using current high flex, high end implant, patient can expect range of motion of 0 degrees to 155 to 160 degrees. That is almost complete and full range of motion. Now here, 3 factors are important. One is whether patient had full range of motion before surgery. Number 2, how obese is the patient. And number 3, how disciplined the patient is regarding physiotherapy and exercise. If patient had bad or low range of motion before surgery, patient is going to take longer time. At 6 weeks, he may be able to attain 90 degrees to 120 degrees. Obese patient takes longer time to achieve good range of motion because of obvious restriction to flexion. If patient is disciplined, follows physiotherapy advice, does his work diligently, he will have excellent range of motion at the end of 6 weeks. Thank you.